When describing the field of occupational therapy, most people aren't exactly sure what the profession entails. Occupational therapists often hear phrases like, "Do you guys find people jobs?" Or, "Isn't it the same thing as physical therapy?" And don't OTs only work in hospitals? For some individuals, there is barely a distinction between an occupational therapist and a doctor. To help you get a clearer picture of what occupational therapy is, let's start with what it really is. Occupational therapy helps people who have physical or mental disabilities participate in everyday activities that they enjoy, need to do, or expected to do. We call these meaningful activities occupations, and they can generally include activities of daily living, which are basically things that take care of basic survival needs like dressing yourself in the cold weather. Instrumental activities of daily living involve a more complex level of ability, like taking care of a pet. Sleep, yes, sleep, is an occupation as humans require sleep to feel restored and ready to take on the day. Leisure involves doing things that you enjoy. These activities typically don't involve work-related obligations, such as watching a TV show. Play, on the other hand, can be a little bit more spontaneous than leisure, like a child playing with their teddy bear. Social participation with friends, family, or a community involves engaging in occupations such as going out to lunch with friends. Education can be an important occupation for school-aged children or college students. And lastly, work tends to be an occupation that occupies a chunk of our time and typically is a need as it's used as a means for income. Now, I know what you're thinking. How does an occupational therapist address all of these occupations? Well, occupational therapists can work in a variety of settings to tackle all of these different needs. OTs can typically work in a clinic setting, a hospital, in an individual's home, or even school settings. Some lesser-known settings that occupational therapy works in can include animal-assisted therapy, like using dogs in intervention, or driver's rehabilitation. It's amazing how many different settings and needs an occupational therapist can address. However, the path to becoming an occupational therapist is quite demanding. Before entering an OT-specific program, an individual must acquire a bachelor's degree, which can be in disciplines like biology or psychology. Then an individual can apply for the master's or doctorate program to gain the required education needed to take the national board exam. After completing the program and passing the exam, an OT is born and ready to change lives. Yes, we really change lives. In fact, occupational therapy has been shown to provide incredible outcomes and is evidence-based. Now you might be thinking, wow, occupational therapy is amazing, but I still don't see how it's that much different from physical therapy. Although both professions tend to work closely together and promote health, they have distinct roles when working with the patient. Let's take Bob, for example. Bob has problems with his lower back and feels lots of pain and difficulty in doing certain things. His PT will help him by stretching and strengthening the muscles in his lower back. On the other hand, his OT will suggest tools like a sock slider that will prevent lots of bending when trying to put his socks on. By helping Bob learn new ways to effectively put his socks on, OTs can help him avoid further and more complicated injuries. Occupational therapy is unique in the sense that it is client-centered, meaning that the focus is on you. An OT might come to learn that Bob's family has a crazy sock competition every Christmas and would like to independently put on his own socks this year. The tool suggested could potentially help him. Bob is an example of how an OT can help an individual, but occupational therapy can also effectively help large groups of people at the same time. The ultimate goal of an OT is to get people to participate in occupations to promote well-being. By independently putting his socks on, Bob can increase his level of self-esteem and have an increased motivation to work on other occupations independently. OTs treat an array of disorders and illnesses and can help people get back to doing what they love most. So, the next time someone asks you what an occupational therapist does, you can tell them OTs help all types of individuals and in many different settings to help clients regain or improve their ability to engage in activities that are meaningful to them. We hope that you enjoyed this video and are able to leave with a better understanding of what occupational therapy is and can spread to the world just how great of a field it really is. And remember, just as Annie Dillard said, how we spend our days is, of course, how we spend our lives.